It's lunchtime. Well, at least for me. Having a little pasta here. Came across my daily dose of fear mongering in terms of the virus. Did want to share a little bit of statistics, but first, we're going to take a look at this video just put out by today, talking about cases continue to rise in 25 states, and of course, setting new infection records. And of course, this is from today. So let's roll that videotape.
Increase in daily coronavirus cases to more than 88,000. All that coming after a dip in late summer. America has also just set a one-week record for new cases. Adriana Diaz is in Chicago, where there is no indoor service in bars and restaurants starting today. Adriana, good morning.
Good morning, Tony. These restrictions are back because the positivity rate, or the percentage of tests that come back positive, has crossed the threshold of 8%. Now, the governor hopes that banning indoor dining will save lives, but the Illinois Restaurant Association calls the ban a death sentence. And this comes as cases nationwide are so high that, listen to this, it's the equivalent of a new diagnosis every second.
We need to clamp down because we need to bring the numbers down.
Illinois Governor J.B. Pritzker says surging coronavirus numbers have left him no choice but to ban indoor eating and drinking.
And we're gonna take a look at these numbers in a second.
In Chicago, indoor socializing is growing as the weather turns cold, says epidemiologist.
In Chicago, they've seen protesting and riots, but if you want to eat indoors,
Michael Osterholm.
We are now seeing so many more people who are congregating indoors.
There's always an expert somewhere.
Where we know the virus concentrates in those settings, and transmission is even increased.
As cases continue to surge across the Midwest.
And this is the one that we're going to discuss.
Michigan's governor tightened restrictions on
South
indoor
Dakota.
gatherings Thursday, and officials in Wisconsin warned they're reportedly on the track to run short of ICU beds in 2 to 6 weeks. In South Dakota, the positivity rate is an astonishing 46%.
46%. Woo.
Meaning nearly half of all tests are coming back positive.
People are acting like there's nothing going on. And
Right, so people are acting like there's nothing going on. I'm going to take a look. In South Dakota, they haven't shut down. We're going to take a look at the numbers.
And it's absolutely maddening.
Kathy James' son-in-law, 56-year-old Doug Raisby, contracted the virus. He was an essential worker in the agriculture industry in Sioux Falls, South Dakota. And even though he was immunocompromised, he couldn't afford to stay home. His wife, Katrina, was only able to visit in person on his last day.
I kind of got to say goodbye, but he wasn't conscious and didn't really know that we were there.
So unfortunately, this person got sick and lost their life.
He just cried. He said he was scared and that he was going to die and that he was going to die by himself.
On Facebook, Kathy James criticized South Dakota Governor Kristi Noem's handling of the virus. The governor recommends vulnerable people stay home. There's no
Now, that's a good recommendation. If you're someone who is vulnerable, like that individual was, you should do your very best. Wear a mask, good hand washing, social distancing, etc. And of course, if the state can, they should try to do something for these individuals, whether it's give them sort of a stipend, or as they've done with either unemployment or stimulus checks, etc. But I'm going to take a look at the numbers in a second.
no statewide mask mandate, and the state has never shut down.
Right, so there's no statewide need for a mask, and the state never shut down. So let's take a look at the numbers, right? So first of all, we want to talk about what's the population like in South Dakota. How many people are there in South Dakota? This is very important, right? So in terms of population, South Dakota has 858,000, almost 800, 858,000, a little over 858,000 people that live in South Dakota, right? So if you want to talk about, well, what are the positivity rates? Well, not positivity rates, but how many patients are there currently in South Dakota that tested positive, right? So we can see that right here. In terms of the occupied hospital beds, there are currently in South Dakota 413 patients that are in a hospital bed right now. 70 of them are in the ICU, right? So looking at South Dakota, you kind of get a little bit of a, the numbers just kind of don't add up from what they're talking about, right? So they're saying, excuse me, they're saying that they have 100% ICU occupancy, which isn't true. They still have quite a few ICU beds. More importantly, when you're actually looking at the numbers, right, in terms of ICU rooms, they're saying that they're in the critical, but they have a large capacity of ICU beds. They still have plenty of ICU beds that you can see from the data. When you actually look at the data, they might be referring to a specific hospital, but when you actually look at all the ICU beds in the entire state, first of all, when you look at all the beds in the entire state, there are 15% of all beds in the state of Dakota are dedicated to someone that tested positive, right? You can see that right there in terms of the total. Now, if you're looking at in terms of available beds, there are still in all of South Dakota, there is still 30% of all beds that are available. In terms of in terms of beds occupied by someone with the virus, it's only about 24%, right? So currently only occupying about 25%, 24.1%. Non-COVID patients, 40%. ICU, all ICU beds available, almost 36%, with, I think it was 70%, 71% of ventilators in use. So this really gives you a much more, excuse me, this gives you a much more thorough picture of what's going on. But even more so, when you actually look at the positive, when you actually look at the number of patients, right? Like I said, there are 413. We said that there are 413. There's 413 patients currently in the hospital. South Dakota has a population of over 855,000 people, right? So in terms of the number of sick individuals, right? Because we don't know if those individuals just tested positive, whether they came into the hospital specifically for the virus, or whether the person came in for virus unrelated issues, and the person, of course, also tested positive. We also don't know what the history, whether these individuals are geriatric patients, whether they're patients who are end of life. They could be hospice patients who are coming into the hospital. Yes, hospice patients come into the hospital. There could be patients who are well past life expectancy that have chronic issues that are basically kind of the revolving door patients that you typically would see in like your medical step downs and your medical ICUs. With that said, right, let's just assume every single one of them, every 413 of them was solely in the hospital for the pandemic. Then what that means is that out of all of the patients, out of all the people, in terms of percentage of why the governor did not close down the state, or the mayor, whoever it was, only 0.0004%, right? As you can see right here, right? Right? Zero is 40. This is basically what this means, right? minus 4 means that there are 4 zeros, right? 0.0004% of all the inhabitants that live in South Dakota are sick and require hospitalization. And that's just a little bit of clearing up the issues.
We're on fire.
We're on fire, right? But when you actually look at the data, right? When you actually look at the data,
if everybody wore masks, would Doug have gotten it anyway?
Right? When you actually just sit for a few minutes and actually look at the data, you'd be surprised. And it's literally like that from state to state to state. In terms of the entire country, right? In terms of the entire country, if you want to see how many beds are occupied by someone who's tested positive. Again, I don't know. More than likely, I doubt every single one of those individuals is in the hospital for the virus. More than likely, there's a very, very good large amount of them that are there for unrelated virus issues and just also test positive. But let's just say, for the sake of it, every single one of these people who are in America, who are currently in the hospital at this very moment, equal 4.8% of all hospitalizations in the entire country. And so when you think about that, for example, even here in New York, it's 2.9%. Florida is 2.9%. I think New York might have ticked up to the 3% mark. When you think about that, ask yourself, why are so many states still closed?